Thank you, Nick. Thanks for having me here. It's a pleasure, an honor and a pleasure to be here. To speak at the end, at the final session of such an interesting conference is quite a challenge because there's so many interesting things have already been said, and there's kind of a challenge to add onto that. What I would like to look at is, and when we discussed my intervention with Nick, he actually came up with this title. Thank you for that. Very good. Where we have consumer, we have market, and we have user friendliness. And I think these are things I would like to develop on. And as soon as I get my presentation, it should come up. Okay. Yes.
Yes, I think if press the...
Oh,
okay.
It was me.
Okay.
Sorry. Here we are. Thank you. Good. So what I would like to look into, quite a quick overview, is like looking into what are consumer-led innovations. Innovations are actually, we look at it that innovation no longer take place in a lab, no longer takes with locked up people. It takes up, it is made where actually technologies or where innovations are used, and that would be my main point. And you would see that I will use a lot of examples from the mobile health area, because that is actually where users are more involved. And then we had just the Mobile World Congress in Barcelona, where we spoke a lot about mobile health. So that's what I will be looking at. And then we'll look a little bit into how can we better understand how actually patients are using these new technologies. First of all, I would like to take you to a complete different field, a different industry, and we will have just a quick look at if it works.
Just wave the card over the reader and hop on the train. Make your purchase. Buy tickets for your favorite event. Collect loyalty points. Lock or unlock your door. Around town, at the store, at home, at work. In the blink of an eye, the world has become more convenient. Sony has already shipped 100 million Felica IC chips. Felica technology, making life simpler in smart ways. Felica is used for a variety of public transportation applications across Japan. The Suica card, introduced 5 years ago by East Japan Railway, is becoming increasingly popular, and already more than 15 million cards are in use. From 2004, the Suica e-money service was introduced, allowing the Suica card to pay for purchases in shops and convenience stores located in and near JR stations. The number of these shops has already reached 4,000. In January 2006, the mobile Suica service made its long-awaited debut. Users of mobile phones with Suica card functions can ride trains simply by passing their phone over the sensor plate of the automatic ticket gate. They can check the remaining balance, scan all purchases made, and even recharge the embedded Suica card anytime, anywhere, using the mobile phone's communication function. Japanese mobile...
So that is just as an example. Why do I use this example? For several things. This technology was introduced because there was a need. The need was identified, the problem identified that there was always these long queues of people who wanted to go on the metro because they had to take out their card, they had to wait that it opened. So they wanted to solve a problem, and they introduced this card. That was a few years ago. And then they said, well, with this card, we can add additional functions. We can like have it as a money card in order to shop in the shops around the metro. And then once we have this concept, we then increase the technology content. No? We can use now, they can use their phones in order to do that. So here's the important thing is we have observed that there's a problem. We introduce a solution to that problem, and then we extend by watching how is it used and what other uses can we add to it. And another interesting point here is that we have seen that there are different providers or different stakeholders, actors coming together. We have a public transport system. We have Sony as being a private provider. We have all these different shops around it who participate in that. And that's, I think, in a nutshell, the point I'd like to make, that if we want to move forward, we need to have solutions which are really solve a problem and bring different interest together. So let's look at the health sector. I will bring some examples. The Telemedicine Clinic is in Barcelona. It's teleradiology, and they sit in a very nice tower overlooking Barcelona. Usually the X-ray department is kind of down at the basement. Here you're on a 21st floor with this wonderful view. Interesting here is, so they examine X-rays from North Sweden, and they have a whole group of radiologists sitting there together. The technology they put together is quite state-of-the-art, but it's nothing really important. It's just by the way they've networked it, they put it together, that this is interesting. And the interesting point here, that it really corresponds to needs. That they have identified a need in northern Sweden where they don't have enough. They have the machines, but not enough radiologists. So that's how this business concept was developed. And then as well, they actively involve all the different players, the radiologists, the hospitals, in the concept. The other one as well is another example from Barcelona, Advanced Medical. They have actually started, they wanted to create a web-based, that was in the end of the 90s, a web-based patient net doctors, and they just found it didn't work. So they looked into what is the need, and they extended it having a second medical opinion. So here the technology is not the most important, but it's responding to the need. People want to have access to first level medical quality medical advice, and that's what they provide, having doctors sitting there and being the case manager. For this, they now extend to other areas such as overtaking the supporting chronic disease management with phone services, etc. So here again, my point is the need identified is important, and then it extends using or not more or less technology. What do they all have in common? Is this? The important point is how do I identify this need? How can I come to find a good solution? And there were some interesting examples here of using the design process. I think one of the posters as well used that, the poster from Scotland. I found this very interesting. So here, the IDEO way, IDEO is a company who have designed the mouse, have designed a lot of really interesting things. And this is just a process, is observation, like seeing what is the problem, what is the need of people, brainstorming, then rapid prototyping, having a prototype and implementing it rapidly, and then refining and implementation. And that has been used. At IESE we do a case study on Design That Matters, which is a Boston-based company who does technology for developing countries. This is a device for phototherapy for babies, and this is kind of part of the process how to develop that. Prototyping, this is Will, which she went with this to Vietnam in order to try it out, and they found out it's too big. Like American people are taller, and we put it there, and these tiny Vietnamese nurses was just far too big for them. So they went back to the lab and made it smaller. No? So this is the idea of having a prototype which is easy to test, and then go back and try it out. Kaiser Permanente used it for services, and here's another.
Design Thinking 101. What is design thinking?
I think it's one of the few processes that you can tackle really large challenges, but from the human perspective.
How does Kaiser Permanente engage frontline staff in design thinking?
We really try to turn frontline staff, our nurses, into co-designers. And I think what that means is finding those few folks early on who really want to share their dreams, their desires, their pain points with us, and then slowly taking them through our process, which includes observation. So they have to be willing to want to be shadowed. They have to be willing to go a little slower in their processes and sometimes lead us through the expertise areas.
Yeah.
But then what it really means is taking them through the ideation phase, and that's my favorite,
Yeah.
where we inspire our frontline staff to really release all the great ideas inside of them and help them rapidly prototype them. And to see that actually go in just a few hours from nothing to these low fidelity prototypes, which we all start sensing there's a magic going on, and we know that within a few weeks these things are going to be in action for real in a hospital.
Why is design thinking so powerful?
Because it gets to the heart of the needs of the users. My favorite story, when we were in Hawaii, there was that nurse, and she had worked for 17 years as a nurse. And during the report out, she started crying and said, in 17 years, no one has ever really understood what my needs are and really designed solutions to fit them and has listened to me, and she really felt heard. And I think that feeling heard, meeting the needs, that's the power of design thinking.
I love it.
So this is the idea, but probably some of you have already seen or known about the Kaiser Permanente experience, where they do the innovation on health services, which is like not technology, but it's just the health services, or just it's the health service management, which is an important part. I don't want to go into details in there, but I thought it was interesting to see how this process worked. Let's see how this is now in the mobile health, in health technology. There are a lot of apps out there. Apparently, I just put a few up there on it's on-time monitoring. There are about, apparently the last report I read was 10,000 of apps out there, and maybe as I talk, there will be adding a few more. The report, and here I put some up which I found are present here at the conference, and I thought it would be nice because there have been a lot of interesting examples here. Now, this market is growing. Now there is increasingly, apparently by 2015, it will make up what they call the clinical mobile technology market will reach to 10% of the whole IT market, and it's a growing market. People use it. The apps, the different apps, they use it additional to their normal phone function. So it's something add on to it, and very often. This is a study from the United States. They don't ask, they don't have anyone to ask. They just download the thing and then they try to use it. No? So it's a kind of private growing market. Now I think the point, we will come back to that here, the important point is there is a market out there where people are willing to pay for applications. And there are different companies, private sector companies, who are very interested in continuing to develop this market. Then I have been looking into, well, what are the studies out there which will tell us, and we have heard a lot of studies here, the development, the demonstration project, the development studies which are out there. What I have found that very often these are, well, I put a few out there. I'm not an expert, no, in like cognitive task analysis, video recording, think aloud reports. They're all centered about the user. Very important studies, no, but the user, the professional user, no, how do professionals use it? There are not a lot of studies out there which will look into, well, how this has actually been taken up and used by the patients or by the consumer. How does it influences his everyday life? And so there are, on the other side, interesting activities out there to encourage elderly to use the IT, and we have Care Talk is one of them, which is present here. That's why I put it up here. And so there are a lot of interesting experiences out there. Fine Day is another one, social networks for elderly people. So all these are interesting ideas in trying to promote engagement and sustainability of the user. use of IT. Living labs are other examples. I just have a few examples here from Helsinki, from the Netherlands. This is one from Catalonia, the eHealth living lab. The important thing of the living labs is exactly what it says, that it will provide us additional information on how technology is used. That we had someone saying this morning, well, there is now a lot of evidence and let's just go do it. Sounds fine, but I think if we do that, then we should actually accompany it, better understand how is technology used in the everyday life, and that's why these living labs are so important. Because if not, something can happen. What happened this is another the patients like you, social networks. This is interesting for the social network, the function for patients, but very often people forget what is behind. Behind is a huge data collection on how do actually people live with their illness, how do they take their medication, and this information will be important in order to design future treatment, etc. So this is another way of gaining insight into how patients, more information on patients and their illness and their use of medication. But there's a risk as well with technology, and this is an example from the Netherlands, where they started the HPV vaccination, and then the girls went up on the social network and said, "This is not good. This is this is dangerous, etc." So they had to stop this, and they kind of stopped the whole campaign of vaccination, and then designed a campaign where they were heavily involving then the social networks and videos, etc., and made use of the social networks in the positive sense. Social networks, we have to be very aware of that. Once something is out there, it gets autonomous. You cannot control it. No, if we now talk from a marketing type of spirit, like you would like to see that your message stays, in the way you want to do it. If you put it out in the social networks, there's always a risk that it is being taking an own way, an own life. I have here an example from another company, actually from Catalonia, FlowLab. They did a patient study, and I left it in Spanish on purpose because I thought it was nice. But there are two things interesting here. One is like, what do we know? What is the patient be knowing about technologies? And here we have, he's an expert. Well, he's a technophobe. He has a basic knowledge. He's advanced knowledge, or he's an expert. And then on the other side, what is his attitude towards his illness? No, is he denying his illness? Is he passive? Is he very practical about it, or is he very perfectionist about it? And based on that, I can actually have a complete different way how I involve patients in different technologies. FlowLab is an SME. They have different projects. They work with different. They work with the hospital in Catalonia. They work with primary care services. They work with an insurance company. They work as well with Telefonica. So here's another point from our Japanese, the Felicia card, the Japanese example, is that interesting and successful application are actually those where you involve all the different players or actors in the field. This is a study they did, and here we have 2,000 obesity, hypertension, diabetes are some of the illnesses here, and here are the results in terms of reduction of hospital stays, reduction of emergency visits, etc. So there are some classical studies done as well in terms of efficiency of what they do. Another example of gaining a better knowledge on my patient is the BASE study in Berlin. It started in the early 90s. The BASE 1, the BASE 2 in 2010, and there actually looked into different risk factors of the aging population in applying technology, sensor technology, in order to study when do people fall, etc. And all this is like embedded in technology approach. And here as well, again, we have different players joining in this effort, which is the city of Berlin, different universities like the Charité is involved, and different health insurances. And once I have a good knowledge, in this case of the Berlin aging population, I will be much better able to design good technologies for them. So in order to conclude, the main lessons, I think, is like identify problems and needs and create opportunities. I'm from a business school, so we talk about opportunities. No? What is an opportunity? It could be a business opportunity. In the Japanese example, we have a public problem. Public transport is a public issue, but we have private providers getting around this public problem in order to solve the public problem, and additionally private issues. So I think that is this win-win we should be trying to use. Better understanding of the context will facilitate use and make it part of everyday life. This is the iPod example is one. No, they have really studied how do people use these devices, and then I can add on additional function. The iPod, for example, together with Nike, you have this device for running, which then gives you the account of how much you have been running and how quickly you were. And all this will increase efficacy, use, sustainability, and efficiency. So network business concept, I said, there's different players, different interest set, and this very complementary approach. This is, for example, this is a German health insurance company. This is statutory, so it's in the public public domain. They got together with Deutsche Telekom, and they for designing the new webpage for Barmer. They interviewed 5,000 users, 5,000 insured by the Barmer, and they got the outstanding achievement for the Interactive Media Award in New York in April 2010. So here is just one example of getting together of a private and a public company. And I think the last idea I would like to leave with you, we have seen it in the Kaiser Permanente example, is like using the creativity which is out there with the patient, with the professionals. So here is the IDEO Open. Use open creativity, where how might we improve maternal health with mobile technology for low-income countries? And this is something that just started and got out to the open IDEO community, how they call it, and then everybody can in there and can put examples. I think this is a good way of going about finding user-friendly technology and have really a market, a consumer market being developed, where I have joined all the different actors which can contribute to that. From the Mobile World Health Conference, I spoke with a lot of people. I spoke with O2 now as well. The big telco companies losing a lot of business because everybody has the smartphone now, so you don't have SMSs, you don't use SMSs anymore. They need to develop new content, new ideas, and they're very open for supporting. And we see this with Telefonica in Spain, with Deutsche Telekom in Germany, or with O2 and other telco providers here. So there are a lot of opportunities out there. Thank you very much.